Regarding the anti-aging benefits of methylene blue, that's mostly observed in the skin. So from a longevity slash cosmetic appearance perspective, methylene blue makes you look younger with perceived anti-aging benefits. Okay, back to the evidence-based unique characteristics of methylene blue. Methylene blue might alleviate Alzheimer's syndrome by improving mitochondrial function. It increases acetylcholine levels in the brain. It has antioxidant effects in the brain. It inhibits beta-amyloid aggregation and may dissolve existing beta-amyloid plaque in the brain. And methylene blue binds tubulin-associated unit protein and prevents tau protein hyperphosphorylation. But this is only observed in the aforementioned clinical trial dosages of 60 milligrams to 300 milligrams methylene blue orally daily. Dosages which are way too high and where side effects generally start to manifest. Methylene blue might alleviate pain after surgery, observed at 50 milligrams daily. Methylene blue might alleviate symptoms of depression and anxiety, already observed at 5 milligrams daily. So these are the dosages that we're a little bit more interested in. Methylene blue might alleviate Fluorona C19 acute and long hauler syndrome. It has potential antiviral effects. It improves mitochondrial function. It has antioxidant effects systemically, not just in the brain. Methylene blue enhances the oxygen carrying capacity of red blood cells by reducing ferric iron back to ferrous iron, which is what is prescribed for methylhemoglobinemia. Methylene blue offers erythropoietic effects at therapeutic dosages, the dosages that it's investigated in during clinical trials. Methylene blue reduces chronic fatigue and body aches and reduces chronic systemic inflammation. Now, again, these effects are observed at 0.5 milligrams to 2 milligrams per 1 kilogram of body weight when administered intravenously daily, or 1 milligram to 4 milligrams per 1 kilogram of body weight when administered orally. Dosages which are considered to be in the ballpark of inducing various side effects. Methylene blue has systemic anti-inflammatory effects. It reduces pro-inflammatory cytokines and chemokines, modulates macrophage and neutrophil immune cell function. Methylene blue has systemic antioxidant effects. It increases nuclear factor erythroid 2 related factor expression. It upregulates superoxide dismutase, catalase, glutathione peroxidase, and glutathione reductase activity. So that's very, very promising. That's at all dosages, but you get a dose-dependent effect. Regarding the antioxidant benefits, as well as the anti-inflammatory effects. So that's a dose-dependent effect observed at low dosages, which I'll recommend at the end of this video. Methylene blue improves skin quality. It enhances skin viability and skin hydration, resulting in skin anti-aging effects. It increases dermis thickness, promotes wound healing, and upregulates elastin and collagen 2A1 synthesis, resulting in a more youthful appearance. So regarding a brief side tangent here, regarding the anti-aging benefits of methylene blue, that's mostly observed in the skin. So from a longevity slash cosmetic appearance perspective, methylene blue makes you look younger with perceived anti-aging benefits. And these anti-aging benefits in the skin are very similar to injectable glutathione, leading me to believe that a combination of injectable glutathione with oral methylene blue, you don't need to inject it, don't be silly. Injectable glutathione with oral methylene blue, both at low and conservative yet effective dosages, should enhance your appearance, making you look more youthful, which allows you to say that you have anti-aging benefits. And these are actual anti-aging effects. Methylene blue protects against skeletal aging by improving mitochondrial function like it does everywhere else. And it also improves antioxidant status within bones. So if you're a little bit older and you have a lot of oxidative stress in the bones resulting in bone aging, then methylene blue might be able to protect against it, resulting in actual anti-aging effects. Methylene blue affects the gut microbiome diversity and composition. It has antimicrobial properties, might prevent candida overgrowth, might disrupt the beneficial bacteria that play an important role in digestion, immunity, and metabolic health. But this is only observed at higher dosages beyond 2 milligrams per 1 kilogram of body weight when taken orally, not subcutaneously or intravenously, because that bypasses the gut microbiome. Methylene Blue increases cognitive performance and offers neuroprotection. It passes the blood-brain barrier, reduces oxidative stress in the brain again. It increases serotonin, dopamine, and norepinephrine levels, like I mentioned earlier. Again, assuming you keep the dose moderate and you don't combine it with some of the aforementioned medications or over-the-counter supplements. Methylene Blue improves mitochondrial function in the brain, ATP synthesis in the brain, and reduces beta amyloid levels in the brain, resulting again in cognitive performance and neuroprotection overall. Methylene Blue increases erythropoiesis at moderate dosages. This is very important for you to understand when you start stacking methylene blue with erythropoietin or other erythropoietic compounds like boldenone, for example, or anadrol, or sleep apnea. Also increases your hematocrit and red blood cell count. It reduces oxidative stress in erythroid progenitor cells. It reduces nitric oxide levels, lowers methemoglobulin, which is the oxidized hemoglobin, which then increases oxygen carrying capacity of the red blood cell count, as the hemoglobin can now carry more oxygen around. And that enhances hypoxia-inducible factor 1 alpha stability. All might result in increased erythropoiesis. And this is observed at moderate dosages between 0.1 milligram to 1 milligram per kilogram of body weight when taken subcutaneously or intravenously daily, or at a little bit higher dosages, 0.5 milligrams to 2 milligrams per 1 kilogram of body weight when taken orally or sublingually. So again, if you're a 100 kilogram bodybuilder, from 50 milligrams per day onwards, you might experience erythropoiesis unless you combine methylene blue with other erythropoietic compounds. And methylene blue actually inhibits erythropoiesis at higher dosages by increasing oxidative stress and disrupting mitochondrial function, damaging erythroid progenitor cells, causing oxidative stress to hemoglobin, which is the Heinz body formation and even resulting in hemolysis. And methylene blue interferes with erythropoietin receptor sensitivity. And this is observed medically at dosages beyond 2 milligrams per 1 kilogram of body weight, either taken subcutaneously or intravenously daily, or beyond 3 milligrams per 1 kilogram of body weight when taken orally or sublingually daily. But anecdotally, I see this effect of a reduced hematocrit and reduced red blood count. We're talking about a hematocrit of like 37 to 39%, which is very low for a male bodybuilder, beyond 25 milligrams methylene blue daily. So it seems that erythropoiesis already starts to occur at 3 milligrams to 10 milligrams methylene blue daily, even though medically that would start to occur beyond 0.5 milligrams per 1 kilogram of body weight daily. So that's way higher in a medical setting. But we as bodybuilders or fitness enthusiasts combine methylene blue with erythropoietic compounds. So at 10 milligrams methylene blue daily, unless you're using something to inhibit erythropoiesis or reduce hematocrit levels, you might see that hematocrit and red blood cell count starts to shoot up. And beyond 25 milligrams per day, regardless if you take erythropoietin or boldenone or anadrol, or you have sleep apnea or not, you might see a reduction in your hematocrit and red blood cell count. So again, if you start escalating the dose upwards, but even at low and moderate dosages, blood work. Do your blood work to prevent issues with your complete blood count parameters. And now for the really bad news, methylene blue reduces cerebral blood flow by inhibiting nitric oxide synthase enzymes and lowering nitric oxide levels. It inhibits soluble guanylate cyclase enzymes and lowers cyclic guanosine monophosphate levels, inducing vasoconstriction and impairing blood flow to the brain. But this is only observed at higher dosages beyond 0.5 milligram per 1 kilogram of body weight. 100 kilogram bodybuilder taking 50 milligrams methylene blue, and the blood flow to the brain might be impaired. So again, the dose is the poison, like I say every single time. Methylene blue induces oxidative stress at higher dosages, observed at dosages beyond 2 milligrams per 1 kilogram of body weight. So don't do that unless you suffer from a medical condition where you need methylene blue to get you out of that particular scenario. Methylene blue causes acute toxicity at extreme dosages, where it induces hemolysis, methemoglobinemia, and severe oxidative stress within red blood cells, and also induces severe neurotoxicity. And this is observed at dosages beyond 7 milligram per 1 kilogram of body weight daily, aka 700 milligrams methylene blue for a 100 kilogram bodybuilder. And methylene blue causes hemolysis in glucose 6-phosphate dehydrogenase gene deficiencies. So if you suspect a G6PD gene deficiency in your genetic makeup, please do a genetic analysis with 23andMe before you start taking methylene blue, because that could result in significant hemolysis and, well, basically death. But the good news is that there might be potential synergistic effects with PPR modulators like telmisartan or cardarine, because methylene blue increases peroxisome proliferator activated receptor gamma coactivator 1 alpha expression, which might enhance fat metabolism. Now, I personally didn't experience any of that. Comparing a low and effective dose of methylene blue with an effective dose of telmisartan and an effective dose of cardarine, which I also have a deep dive on. If you want fat loss, stick with cardarine. The methylene blue and the telmisartan on top of that might offer a 1% benefit, which is basically unnoticeable in the bigger picture.